Here we will draw the deep and superficial muscles of the posterior lower leg. To begin, start a table. Denote that the superficial layer comprises gastrocnemius and soleus. Denote that the deep layer comprises, from lateral to medial, flexor hallucis longus, tibialis posterior, flexor digitorum longus. Then denote that the primary action of the posterior compartment muscles is foot plantar flexion and leg flexion. Now let's draw the posterior leg muscles. For reference, let's draw the bony structures. Establish the medial-lateral orientational plane of our diagram. First, draw the distal femur. Indicate its medial and lateral condyles. Then draw the tibia, next the fibula. Indicate the interosseous membrane between them. Then draw the tarsals. Draw metatarsals 1 through 5. Draw the phalanges, 2 on digit 1 and 3 on digits 2 through 5. Now indicate where the calcaneus, your heel, lies within the posterior tarsals. Then the soleal line. Lastly, label the fibular head. Next, let's draw the muscles of the posterior leg. Redraw their bones. Distal femur, tibia, fibula, interosseous membrane, tarsals, metatarsals, and phalanges. We begin with the superficial muscles. Draw the wide, flat soleus muscle. Show that it arises from the soleal line of the tibia and the head of the fibula and inserts on the calcaneus. Soleus derives its name from its fish-like appearance. Sole is a type of fish. Now let's draw the gastrocnemius. Show that it originates from the distal femur, is at its greatest width along the proximal tibia, and narrows distally to insert on the calcaneus. Delineate the medial head medially and the lateral head laterally. Then distally show that the gastrocnemius joins soleus to form the calcaneal tendon or Achilles tendon or triceps surae, where they insert on the calcaneus. Next, let's draw the deep muscles of the posterior leg. Redraw their bones: distal femur, tibia, fibula, interosseous membrane, tarsals, metatarsals, and phalanges. Draw popliteus, which arises from the lateral condyle of the femur and inserts on the medial proximal tibia. Then draw tibialis posterior, which arises from the proximal tibia, fibula, and interosseous membrane, and inserts on the tarsals, specifically the navicular and the medial cuneiform. Intertextual variation exists regarding its tarsal insertion sites. It's also shown to attach at all cuneiforms, cuboids, and bases of metatarsals 2 through 4. Tibialis posterior is the deepest muscle of the posterior compartment. It lies directly against the posterior tibia. Lateral to tibialis posterior, and partly overlying it, draw flexor hallucis longus, which arises from the fibula, specifically the distal 2/3, and the interosseous membrane, and inserts on the base of the distal phalanx of digit 1. Remember, hallucis refers to the big toe. Medial to tibialis posterior, draw flexor digitorum longus, which arises from the mid-tibial shaft, and inserts on the distal phalanges of digits 2 through 4. It's important to recognize that the tendons of the deep muscles of the posterior leg cross at the ankle. Consequently, from lateral to medial, superior to the ankle, their order is flexor hallucis longus, then tibialis posterior, and then flexor digitorum longus. A mnemonic to remember this is "have a terrific day." Have referring to hallucis, terrific to tibialis, and day to digitorum. From medial to lateral, at the ankle, their order is tibialis posterior, flexor digitorum longus, and flexor hallucis longus. A mnemonic to remember this is Tom, Dick, and Harry. Tom for tibialis, Dick for digitorum, and Harry for hallucis. Now let's create a table to organize key information about posterior compartment muscles. Write the following headers: muscle, origin, insertion, and action. Then indicate that within the superficial layer, soleus arises from the proximal head of the fibula and the soleal line of the tibia and inserts on the calcaneus via the calcaneal tendon. It plantar flexes the foot. Gastrocnemius arises from the lateral and medial femoral condyles and inserts on calcaneus via the calcaneal tendon. It plantar flexes the foot and flexes the knee. Next, indicate that within the deep layer, popliteus arises from the lateral femoral condyle and the popliteal ligament and inserts on the proximal tibia. It flexes and medially rotates the leg. Tibialis posterior arises from the proximal tibia, fibula, and interosseous membrane, and inserts primarily at the navicular tuberosity and medial cuneiform. It plantar flexes and inverts the foot. Flexor hallucis longus arises from the distal two-thirds of the fibula and interosseous membrane and inserts on the base of the distal phalanx of digit 1. It plantar flexes the foot and flexes the distal phalanx of digit 1. Flexor digitorum longus arises from the middle tibial shaft and inserts on the distal phalanges of digits 2 through 5. It flexes the corresponding toes and plantar flexes the foot. Now let's tie together structure and function in the posterior leg. First, indicate that because popliteus and gastrocnemius arise on the femur and therefore cross the knee, they act on the leg. Highlight that each muscle, except popliteus, plantar flexes the foot. This is possible because each of the muscles, except popliteus, crosses the posterior ankle. Then indicate that flexor hallucis longus and flexor digitorum longus each flex the digits upon which they insert. Flexor hallucis longus flexes only digit 1, and flexor digitorum longus flexes digits 2 through 5. This concludes our diagram.